providing timely, relevant content to providers who care for children. Welcome to Pediatrics in Practice, presented by Children's Mercy Kansas City. Here's Dr. Michael Smith.
So our topic today is evaluation and management of infants of diabetic mothers. My guest is Dr. Jessica Brunkhorst. Dr. Brunkhorst is a neonatal and perinatal specialist at Children's Mercy Kansas City and assistant professor of pediatrics at the University of Missouri Kansas City School of Medicine. Dr. Brunkhorst, welcome to the show.
Thank you for having me.
So let's talk about gestational diabetes first. Obviously, this is a problem we're starting to see more. Can you give us a little insight to how bad this problem really is?
Yeah, definitely. As we're starting to see the rates of obesity rise in the general public, it increases the chances that moms will develop gestational diabetes. And so with the increased prevalence on the maternal side of things, we're seeing much more complications for infants, and that could mean stays in the NICU and a host of different issues.
Yeah. Let's talk a little bit about that. What are some of the fetal conditions associated with gestational diabetes?
So the two most common ones that we see in the majority of babies is macrosomia, or very big, large birth weight babies, and then hypoglycemia and low blood sugars. So those are the two most common complications we see, but especially if the diabetes was pre-existing before the mom was pregnant, the baby is also at risk for congenital anomalies like heart defects and bowel problems and renal problems and a host of other issues as well.
Dr. Brunkhorst, at Children's Mercy Kansas City, run us through the initial evaluation that you go through as the expert in gestational diabetes and taking care of the infant. Run us through your approach to this.
Okay, so kind of first and foremost is close glucose monitoring. If the babies are having issues with hypoglycemia, then we'll either start with D10 boluses to get their sugar up instantly, or kind of a slow and steady glucose infusion, so that we're not causing big peaks and valleys and roller coaster rides with their glucose metabolism. There's also been lots of talk in the literature, and certain places are using glucose gel to help stabilize the babies on the well baby nursery side of things. Usually by the time they've made it to the NICU, we would go with a glucose infusion as opposed to trying other feeding regimens and things. Once we get glucose under control, it's really a matter of looking for what risk factors the babies have for other complications. So if suddenly we're having issues with oxygenation, does that mean the baby's having a component of respiratory distress syndrome? Does that mean there's underlying congenital heart disease? What does that mean going on for the baby? So really, once glucose management is addressed, it's looking at what clinical signs the infant is presenting with and then tailoring our workup from there. So do we need a chest x-ray? Do we need a cardiac echo? Do we need a renal ultrasound? Looking at a CBC for macrosomia or polycythemia, monitoring for hyperbilirubinemia, and looking at all the other complications.
Over the last, few years where we've had so many advances in technology and diagnostics, all that kind of stuff, what do you think is one of the best things that has occurred, at the hospital when it comes to taking care of these infants that really has improved outcome?
Well, I think just recognizing that hypoglycemia does have long-term effects for the infant, and being much more aggressive with the treatment and management of it than we used to be. I mean, there's definitely studies out there that are demonstrating that episodes of hypoglycemia that we otherwise would have thought were benign could have long-term effects for the baby. And so I think really recognition and awareness of the problem and being more aggressive with the treatment and management of it going forward are probably the biggest things. There's talk about doing continuous glucose monitoring for babies and what that might look like, but we're just not quite there yet. But I think that this is definitely going to be a hot topic with lots of changes to come in the near future as we are beginning to recognize what could be long-term complications from this.
When we talk about high-risk pregnancies, obviously gestational diabetes falls into that category. Tell us a little bit about the types of professionals that you are working with at Children's Mercy. Who's involved with actually taking care of the mom and the infant?
So definitely the neonatologist can get on the front lines once the baby is having enough issues to buy themselves a trip to the neonatal intensive care unit. And then depending upon the severity and how long the issues are going on, oftentimes the endocrinologist will get involved. And then if other organ systems are involved, such as heart defects, which are common with these babies, then our cardiology team would also be involved. But the great part about Children's Mercy, we have all the specialists with easy accessibility and nearby, and so they're there to help us when these kiddos present with complications.
So, Dr. Brunkhorst, in conclusion, like what would you like practitioners to know, specifically, community physicians, nurse practitioners, what would you like for them to know about managing infants of diabetic moms?
Well, I think that this is definitely a common problem that I'm sure everyone is struggling with, both on the well baby nursery side of things and as well as NICUs across the country and in all areas. And I think probably the most important thing to recognize with management is just we're used to the big babies and the hypoglycemia, but knowing that there's also other issues that we need to screen and look for, such as cardiac disease and hyperbilirubinemia and hypocalcemia and polycythemia. And so just recognizing that while glucose usually is what we first see with these babies, that there could be lots of other ongoing issues as well.
Dr. Brunkhorst, I want to thank you for the work that you are doing at Children's Mercy, and also thank you for coming on the show today. You're listening to Pediatrics in Practice with Children's Mercy Kansas City. For more information, you go to childrensmercy.org. That's childrensmercy.org. I'm Dr. Mike Smith. Thanks for listening.